Hi guys, I'm going to come on today. It's going to be a little bit longer than usual. There's a few things that have been coming up that we've been noticing on the continuous care notes. So I was asked to do a video and go over a few reminders and point out some things that we're noticing in the notes. This way you will see the video and you would be able to fix, if you're doing any of these things, you'd be able to fix it because they're really important. Once you hear them, you'll understand. So the biggest thing is communication with your case manager, and what would make you have to call or report off to your case manager. You should have open communication anyway, but there are some things that can happen throughout your shift or going into a shift that would happen, and you would need to definitely reach out to your case manager as soon as possible. So I'm going to give you a few examples of when you need to discuss anything with your case manager. So for one, it would be anytime that you go with your patient onto a doctor's appointment, even if there's no changes, just a quick phone call to your case manager saying you were here, you just left and you're going back to the home, this is what happened, this is what the doctor said. Just a simple communication as far as that goes, and it's important to always document when you do your continuous care note for that shift that you called the case manager. So it's documented that you're following through after a doctor's appointment. The other one that comes up a lot is if there's a new order that you get. If there's a phone call in the house or the mom just so happens to have a new med or a new order, anything different, something different from the pharmacy comes into the house and it's not reading what the care plan says, you need to call the case manager right away. This way you talk with her and you have a better understanding of what you're supposed to be doing. Another time would be if there's any change in condition. You go into your patient's house and you're doing your assessment, or even throughout your shift, you see that things are declining, he's changing, baseline is changing, whether it be vitals, increase in blood pressure, a fever, just isn't out of his baseline or her baseline, you would want to call the case manager just to let them know that there's something going on and that you wanted them to be aware. And again, you would then document that on your CC note that you called the case manager, you made them aware. Anytime there's any change at all in a patient's skin breakdown is a big issue with a lot of our patients. We have to make sure that if there's any redness, any area at all that looks a little bit like it could turn into something, it's better safe than sorry. You document it and you call the case manager right away. Anytime there's a sick plan initiated or started, you have to let your case manager know that you started the sick plan and why. Give her reasons. This way she writes a note, whether she has to call the doctor. This way everybody's on the same page and everybody knows. And then that also goes into the MARs. If you start the sick plan and the case manager knows, then she'll know when to look for the sick plan to be signed off on the MARs. So it all comes together. Anytime there's a new infection at all, if you would call the case manager for that, any new infection or onset of anything. If there's any adverse events that happen, like an injury or a fall, any equipment malfunction, you call your case manager. And again, you would document that you called. You're getting the point here, right? Call the case manager. The other time is if there is a missed med for any reason at all, and or if there's not a med available that the patient's supposed to get in the home. You call the case manager, then you'll get a doctor's order for a missed dose, and you'll take the steps that your case manager instructs you to do. So again, you would go back, you would document that you spoke to the case manager and this is what you're doing. Anytime the parent asks you to do anything that we don't have an order for, you right away call your case manager. Some examples of this would be giving meds out of the time that's already ordered. So if the med is ordered for 6 a.m. and the mom or the dad wants you to do the meds at 8 a.m. because they want you to let the patient sleep, that is out of the hour window. That is legally allowed. So you would have to call your case manager and let them know what's going on and why the parent wants you to do that. This way the case manager would call and speak to the parents and explain that we have orders to follow. It's our license and we need to do what the doctor orders and match up with the 485, the care plan. Another one is if the parent wants you to switch out the feed for a Pedialyte because the patient's sick with either diarrhea or vomiting. If you don't have an order and that's not in their plan, you cannot do that. So you have to call the case manager and let them know, and this way you'll follow in suit and see what they say to do and document that you called the case manager. We don't do anything without an MD order, and you always need to remember to communicate with the case manager. It's vital for us to give remarkable care, to have everybody on the same page, and it helps out. And it gives us the ability to know what's going on throughout. If the case manager knows, then everybody else, the staff-wise coming in, would know what's going on too, especially if the sick plan was initiated, if the doctor's appointment was there and there are things that were changed, or even if not, but just an update. So please keep that in mind, that if anything goes on, like the things I said, you always have to call your case manager. Communication is huge in home care, okay? Have a great week. Thank you. Bye.